Hey everyone! Today I'm diving into a step-by-step journey through knee replacement rehab. If you're gearing up for surgery or helping a loved one, this video's for you. First up, let's understand the knee and osteoarthritis. The knee is a complex joint that supports our weight and allows movement. Osteoarthritis wears down cartilage, causing pain and stiffness. That's where knee replacement comes in. Now, preparing for surgery, it's crucial. Make sure to complete all pre-op evaluations, fast as instructed, and pack your hospital essentials. Having family support is super helpful during this time. On the day of surgery, expect to meet your surgical team, discuss anesthesia options, and get prepped for the procedure. It usually takes a couple of hours, and then you'll be on your way to recovery. Post-op care in the first days is vital. You'll start with some light physiotherapy exercises to get you moving safely. Medications will help manage pain, and healthcare assistance will be there every step of the way. Exercise is the cornerstone of recovery. You'll learn moves like leg abduction and knee flexion. Gradually, you'll start walking more as your strength builds. When it's time for discharge, you'll leave with clear instructions for home recovery. Keep an eye on your wound, monitor for complications, and stay diligent with your exercises. Post-recovery, focus on activities that are easy on your knees, like walking and swimming. Also, pay attention to your diet and overall lifestyle to support your new knee. Remember, reach out for any support you need and follow up with your healthcare provider. For any questions or further guidance, contact us at the details below. Thanks for watching, and best of luck on your knee replacement journey.